NCLEX RN practice test questions. Question 1. Set 1. What is the priority when a patient falls? Complete an incident report. Notify the physician. Assess the patient for injury. Move the patient back to bed. Assessment of the patient's condition is always the first priority after a fall. Question 2. Set 2. Which is the correct order of the nursing process? Planning, assessment, diagnosis, implementation, evaluation. Assessment, diagnosis, planning, implementation, evaluation. Diagnosis, assessment, implementation, planning, evaluation. Evaluation, implementation, planning, diagnosis, assessment. ADPI assessment, diagnosis, planning, implementation, evaluation. Question 3. Set 3. A client is diagnosed with peripheral arterial disease, PAD. Which symptom should the nurse expect? Dependent rubor, painless ulcers, bilateral edema, warm skin. Dependent rubor, redness when legs are down, is a common sign of PAD. Question 4. Set 4. A patient with cirrhosis has an elevated ammonia level. Which medication should the nurse expect to administer? Lactulose, furosemide, spironolactone, propranolol. Lactulose promotes the excretion of ammonia through the stool. Question 5. Set 5. Which sign indicates a potential complication of a thyroidectomy? Sore throat, laryngeal stridor, fatigue, dry skin. Stridor indicates airway obstruction, possibly from edema or nerve damage post-thyroidectomy. Question 6. Set 6. A nurse is caring for a patient with atrial fibrillation. What is the primary risk for this patient? Heart failure, thromboembolism and stroke, ventricular tachycardia, hypotension. Stasis of blood in the atria can lead to clot formation and subsequent stroke. Question 7. Set 7. What is a common side effect of ACE inhibitors? Constipation, dry, non-productive cough, weight gain, hyperactivity. A dry cough is a common side effect of ACE inhibitors due to bradykinin accumulation. Question 8. Set 8. A patient with heart failure is prescribed digoxin. Which finding should the nurse report immediately? Heart rate of 72 bpm, visual disturbances like seeing yellow halos, increased urine output, blood pressure of 120/80 mmHg. Yellow halos are a classic sign of digoxin toxicity. Question 9. Set 9. Which electrolyte imbalance is associated with Trousseau sign? Hyperkalemia, hypocalcemia, hyponatremia, hypermagnesemia. Trousseau's and Klosteck's signs indicate hypocalcemia. Question 10. Set 10. What is the golden hour in newborn care? The first hour after birth for skin-to-skin and bonding, the first hour of active labor, the first hour of the second stage, the hour before discharge. The first hour after birth is critical for bonding and initiating breastfeeding. Question 11. Set 11. At what age should a child be able to sit unsupported? For months, 6 months, 9 months, 12 months. Most infants can sit unsupported by 6 to 8 months. Question 12. Set 12. A patient on chemotherapy has a platelet count of 20,000. What is the nurse's priority? Infection control, bleeding precautions, managing nausea, increasing protein intake. Thrombocytopenia, low platelets, puts the patient at high risk for bleeding. Question 13. Set 13. Which is a common side effect of radiation therapy to the head and neck? Diarrhea, xerostomia, hematuria, clubbing of fingers. Xerostomia, dry mouth, is common when salivary glands are in the radiation field. Question 14. Set 14. What is the antidote for heparin overdose? Vitamin K, protamine sulfate, naloxone, acetylcysteine. Protamine sulfate neutralizes the effects of heparin. Question 15. Set 15. What is the therapeutic level for lithium? 0.1 to 0.5 milliequivalent/L, 0.6 to 1.2 milliequivalent/L, 1.5 to 2.5 milliequivalent/L, 3.0 to 4.0 milliequivalent/L. The maintenance therapeutic range for lithium is 0.6 to 1.2 milliequivalent/L. Question 16. Set 16. What is the diet recommended for a patient with diverticulitis in the acute phase? High fiber, NPO or clear liquids, high fat, low protein. During acute diverticulitis, bowel rest, NPO or clear liquids, is necessary to allow inflammation to subside. Question 17. Set 17. What is a major safety risk for toddlers? Sports injuries, poisoning and drowning, occupational hazards, elder abuse. Toddlers are at high risk for accidental poisoning and drowning due to their curiosity and mobility. Question 18. Set 18. Which position is best for a patient receiving a tube feeding? Prone, supine, high Fowler's, left lateral. High Fowler's position prevents aspiration during enteral feeding. Question 19. Set 19. A patient is post-bronchoscopy. What is the nurse's priority assessment? Pain level, gag reflex, urinary output, blood pressure. The gag reflex must return before the patient can safely eat or drink to prevent aspiration. Question 20. Set 20. Which lab value is elevated in acute pancreatitis? Serum amylase, BUN, hemoglobin, potassium. Serum amylase and lipase are significantly elevated in acute pancreatitis.